for the average person that's saying, okay, that sounds a little bit like me these days. I'm toxic. I'm obviously inflamed. I'm having a hard time waking up in the morning at times or having energy throughout the day. Where would you recommend you start with someone? If they were to come to your practice, you run certain tests that everyone should do or certain questions they should be asking themselves?
So generally when we're seeing patients in the office, like we try to boil it down to like, try to get the symptom list, but I try to get people focused on their top 3 symptoms. And quite regularly, people's top 3 symptoms are fatigue, brain fog, chronic digestive issues. Yep. So definitely our goal is trying to work on helping to improve the digestive function because that is the exhaust system. That's how toxins leave our body in the most efficient way. But when there's too many toxins, and then if a person is getting inflamed, that also puts the body into fight or flight, which also then shuts down the normal digestive processes. Remember, you can't be in fight or flight and digest and rest at the same time. So that means not making enough stomach acid. Parasites from the environment can easily gain entry. Again, it sounds overwhelming, but the point is, generally we start with helping to improve a person's normal digestive process and making sure there's enough good bacteria, there's no bad things in there like parasites or SIBO, bacterial overgrowth, and making sure we get rid of any food sensitivities temporarily. So like a detox diet is usually where I'll start with, and it's anti-inflammatory. And it helps establish a foundation because basically we're building blocks that we are constantly trying to help elevate a person's health from. Foundation is just so important. Sometimes it's not easy to get there easily. Sometimes it's very efficient. It really depends on a person's constitution. And, because there's so many issues, I find that one of the most challenging group of patients that we have are not only the ones that are fatigue, brain fog, and digestive issues, but also there's some kind of emotional component to this. And hence, that's why I bring up what we talked about earlier, what's happened over the last 3 years. But there's been a tremendous amount of emotional stress that has been inflicted upon every single American because of the constant, nonstop, pessimistic mass media, information, no matter whether it's in the newspaper or online or through social media. It's really difficult to avoid it. Even for the most astute. I know you probably are as about as good as they get, but you can't easily ignore it. So stress is stress.
It's almost impossible to ignore it. You could do your best, use the techniques that you may have acquired to combat it in many ways. But I know personally, speaking with my father and the clinical team at our clinic, that a number of patients are coming in with fear and confusion.